You see the patient, and it's hard not to get emotional.
Priscilla Opferman
They
helps
need some type
coordinate
of
patient
support.
care at Kaiser's Walnut Creek Medical Center. She believes the pandemic pushed healthcare workers like her to the brink.
The way that it's looking, we're going to be out there tomorrow at 6 a.m. The big items that we need to discuss to make sure that the short staffing crisis gets taken care of are not being brought to the table.
75,000 healthcare workers are poised to strike at Kaiser Permanente facilities over unfair labor practices for 3 days, 6 a.m. Wednesday through 6 a.m. Saturday, the largest healthcare worker strike in U.S. history.
Patients will feel an immediate impact, uh, especially when they need lab work, diagnostic imaging, pharmacy, vision care, and so on. Because most of the employees who are the bulk of those workers in those facilities would be on strike.
August is a conflict resolution expert who was on the former Kaiser union negotiating team. He says while doctors and nurses will be ready to go, hospital disruptions could possibly include clerical staff, meal service, and housekeeping, which affects infection control. Kaiser Permanente, in a statement, said to mitigate the impact of a strike, they have plans to expand Kaiser's network of pharmacies to include some neighborhood locations, will reschedule some non-emergency and elective procedures, and are onboarding critical care professionals to work during a strike.
Kaiser Permanente has an obligation to do those things. They certainly want to provide those services during the strike. It's not going to be easy.
2 other Bay Area unions have approved a sympathy strike. IFPTE Local 20 and OPEIU Local 29 workers say they will also walk off the job in solidarity. They include technical employees, clinical lab scientists, and home health therapists.
I think that this strike should be seen, should it occur, as a national problem that really affects everyone in healthcare.
So to try to sort through the confusion, registered nurses and doctors will be on staff tomorrow if there's a strike. Hospitals, emergency rooms will be open. Check perhaps with your healthcare team if you've got an appointment or you're not sure of receiving other care. Kaiser says they're going to be ready to handle it all. But do keep in mind, if you have images getting done, lab work, support staff, nursing assistants, phlebotomists, call center reps, vocational nurses, surgical technicians, that's just part of a long list of jobs. All those folks are possibly going to be walking off the job tomorrow. Reporting live in Walnut Creek, I'm Leslie Brinkley, ABC 7 News.